Hello, good morning, good afternoon. We're really glad you're here. Are you part of a team that's looking to replace your aging environmental health software? Does it look like it was designed in the 1990s, maybe on Windows 95 or worse? If so, you're at the right place. Let's go ahead and begin. I'm Daryl Booth. I'm very lucky to have worked with environmental health departments for really over 25 years, from Los Angeles County in California to the state of New Hampshire. I feel like I've seen it all. I'm also a technical advisor to NEHA, and I'm extremely fortunate to have a column in the Journal of Environmental Health, Building Capacity. It's been a personal and professional pleasure to write for the journal. I serve today, and I'm with you today as the General Manager for Environmental Health at Excella, which means I have some involvement in almost every project that's going on with this company. We're very lucky to have with us today my good friend, Amber D'Ottavio. Now, Amber also has over 20 years experience, initially for nonprofits, specifically working towards self-sufficiency for persons experiencing homelessness, low income, and certain disabilities. I did not know that about you, Amber. But now she works for GovTech and has for many years, which just means working on computer systems for local and state government. Amber serves today as Excella's Vice President for Product Management, which means she establishes our product roadmap and our product features and a lot more. She's literally the busiest person I know, but she's an expert on Excella and environmental health and this whole process that you're undertaking, procurement. Amber, I'm really glad you're here. Thank you. Before we begin, Amber and I just want to speak to your situation to at least confirm our assumptions by responding to a couple poll questions. So Jill, I see you've opened the poll now, and to our friends online, please make your selections. Thank you for those who are keying in. That really helps us. Hopefully it will help you too. We'll share the results in just a sec. All right, Jill, if that was our first question, maybe we can move to our second question.
Daryl, were you able to see those results?
Yeah, I'm seeing the results. Is everybody else seeing them as well? So the sense here is that we think we're replacing our current solution and we need to see what else is out there. And that's not terribly surprising to us. I also want to mention that if you have additional comments or questions, you can add them to the Q&A icon down below. We don't use chat because chat can kind of take on a life of its own and be distracting, but use the Q&A, and Amber and I will be sure to have time there towards the end.
All right, Daryl, here's the second poll here now. Are you seeing the second poll?
Yeah, let's give folks a second to answer this before we move on.
All right, there are your results.
Great, thank you. Let's begin. Amber and I asked to be here today to make this presentation at this time. I guess said plainly, we think the timing is right to help one another out a bit. We both have a job to do. You may be researching your next software system. We definitely want to put our best foot forward and have very successful projects. Today, we want to convey to you maybe some insider information that relates to your research for your next environmental health software. So Amber, let me ask you to explain, why are we making this presentation now?
Well, in the last 5 years, we can cite massive changes to the environmental health software commercial environment. Tyler Technologies bought digital health department software and now gives preference to Energov. So digital health department customers are now in a spot where they really need to think about what their next data system looks like. HealthSpace bought certain intellectual property from a group called iGov Inc., essentially the former Garrison Enterprise principles. And HealthSpace intends to deprecate its IBM NoteSpace software, something completely new. Some of these companies might now find themselves in financial stress, perhaps with future mergers on the horizon. So it really pays to do your research. Also, city and county environmental health departments are expected to be more integrated with other departments in their local governments. Our analysis indicates that these are the primary reasons for a high volume of new environmental health data projects.
And that's my expectation and understanding too. We're seeing a good number of projects across our desk. We're here to speak to you really as leaders within your own organizations. You're probably here because you and your team are being asked to consider your next software system. We established that. And we appreciate you for what you're doing. We know that's a tough job. What we intend to do today is try to make your job just a little bit easier with these ideas. So Amber, would you please introduce our first tip?
Of course. Now, if your current software system is working okay for you, then we'd call that your daily driver. Your daily driver gets you where you need to go. When it acts up, you know exactly what to do because you've been together so long. But just because your aging system is ready to be replaced does not mean that you can or should recreate it with the next system. Let me say that again. Do not try to recreate what you are replacing.
And this thread and this tip actually comes from conversations we've had with projects that are just launching and have been ongoing. We know it can be difficult to just resist looking for something familiar that is, after all, your basis of reference. But maybe think about it this way. If the driver of an '05 Toyota Corolla is ready for the next car, that good old Corolla is north of 200,000 miles. It rattles pretty good going down the freeway. If you're in that situation, you should not try to find exactly what you had before, not in most cases, because nearly 2 decades have passed and car technology has changed a lot. Now we can expect more efficiency, more safety, more fun when we drive. We have self-driving cars, for goodness sakes. So what we're saying is don't re-specify or just ask for another Corolla, specify a Tesla. So restated, don't try to specify the behaviors of your legacy system in the requirements of your new system. And we suggest you confirm this in your requirements by scouring for any references to the old system. If you're referencing the old system by the name of the screen or the name of the field or what they call things in their documentation, then you are still tied to its legacy. And it's worth one more pass to try to expunge those. This is tip number 1, define only modern requirements. Now, we won't assume that our entire audience is in tune with what a cloud-first strategy means. So let's just start there. There are 2 related terms, cloud and software as a service, or sometimes you see it written out as SaaS, capital S, lowercase a, lowercase a-s. When you licensed software in the 2000s, you almost certainly had to go and buy servers and server operating systems, database software, all that to make it work. Then you had to have staff to secure it, upgrade it, back it up, test it, optimize that the server was going to keep running for you. Jump ahead, when you license software in the 2020s, businesses and governments alike will save those resources, time and stress, if they license access to the software that's already running on servers that are already under management on a scale so much larger and more professional than what your city or county or health district could do. So when we say cloud-first strategy, we're encouraging you to select a solution that's in tune with modern software delivery. And your IT stakeholders, they should not have to be convinced. Most likely, they are already adopting things like Office 365 and other cloud-first solutions for you. It's really super convenient.
So why SaaS? Why cloud? Well, it's a quick start. Access to your system within hours, not weeks or months. When you have a cloud-first strategy, you're already wired to connect with other systems like Microsoft Power BI or Esri ArcGIS Online for analyzing your data, or with payment processors or the county property records, or with Yelp, or with web front ends where your operators can self-serve. You're connected with the cloud. But beware, just because you use the internet to access the software doesn't make it cloud or software as a service. So you want to make sure that you do your research. For example, if your software vendor is offering you a direct connection to your production transaction database, they're really not doing you any favors because this is not secure. There are secure ways to do this, like mirroring that database for local reporting, but direct access to the production data is not a good idea. It's a red flag. True SaaS vendors should have operations and policies that involve physical, application, network, and data level security, as well as backup and disaster recovery. SaaS vendors should conform with top enterprise security certifications like PCI and HIPAA, with strong security policies and auditing programs. As an example, Microsoft Azure has extensive certifications and conducts their audits every year. Fake SaaS platforms will say that they'll take care of your security, but they won't be certified or audited by anyone for their policies. SaaS also addresses version upgrades and refresh cycles that agencies are really challenged with today. As we all know, technology is evolving faster than ever. Cycles for version upgrades, updates, security patches, they're getting shorter and shorter, and it's impossible for agencies to keep up. And the talent that's required to support these cycles are really hard to find. They're expensive and hard to retain, which in the end really just results in a mountain of technical debt that you're left with. So in the cloud, you never have to worry about an upgrade, which is going to allow you to do what you do best, which is protect the public's health. Let others do what they do best, like the backups and the software updates and the infrastructure and the security. Moving to cloud-based systems with automated capabilities allows your employees to spend less time on that maintenance and more time on innovation, which also leads to happier employees. So really in the end, it's a win-win. And because employee burnout rates have been steadily increasing throughout the pandemic, organizations should take advantage of where they can eliminate pain points within their internal processes, and cloud software gives you those options.
Thank you. I couldn't agree more. So just restated clearly, only cloud software makes sense in 2022. Now, to confirm this in your own project, require that the system you're proposing install 0 files on your computer. Only really a browser should be needed. This is tip number 2, use a cloud-first strategy. In our experience, environmental health departments don't often automate or coordinate with other departments in the county or the city. And we can appreciate that if you're in a county that has 20 member cities, coordinating digitally with all 20 different cities and all the different vendors would require a lot of energy and leadership. But there is a sweet spot. In most cases, if you're part of the county and the county has primary responsibility for new residential building projects, which have EH sign-off for septic and private wells, and there's a huge opportunity here. For example, how many of you work with a county health department who have responsibility for approving septic and water well and residential projects? Most likely it's almost everybody. So how many of you log on to the other system to add your approvals and notes so the building project can go forward? Or worse, you rely on paper permits or email back and forth to inform the building department of your approval. This is an example where with your leadership, you should expect that EH and building departments work together from a single source of truth. And that means that the projects initiated in building appear in environmental health, and environmental health approvals are automatically sent over to the building department. I have a term for you to learn, if you don't know it already, API, or Application Programming Interface. An application programming interface means that the system was designed to connect to other systems. That's why the imagery of the plug and the socket. So this is the proper and secure way to interconnect systems. And this is the gateway to all sorts of creative extensions. And I've got a great example. Our friends in the county of Ventura run a backflow prevention program. Many of you may do backflow prevention or cross-connection programs. In Ventura, they monitor 17,000 devices. Now, third parties come through and do all the testing, but the department does the monitoring, the letters, the reminders. And we know from other health departments that the least efficient way to do this is to have testers email the results, fax the results, mail the results, upload the results. I've heard anecdotes for larger health departments where one full-time person just sits there by the fax machine, and as results come in, they record that the test is done. That's more than 50 results every workday. The better way, the way in which Ventura County IT, I think, showed real leadership, was that they developed their own app, an easy way for testers to scan the tag on the device, enter the testing event, and move straight to their next stop. Of course, it's all transmitted through the phone, through the API, and into the back end, recording that a test is done. In fact, Ventura County has been very busy. They have Safe Beaches as an app, and they have Safe Diner as an app, and they accomplish these things using an application programming interface, an API.
And then Ventura really isn't the only example of breaking through the silo. There's many different solutions for this. Other examples include GIS, flow through to citywide or countywide accounting systems, validating professional licensing where it applies, let's say at the state level. So really at this point, I mean, now is your moment to break that silo, that practice of working alone. There's no reason you should have to exit your screen and then log into another screen or application to finish your work. So to confirm this, require that the new solution includes a documented public-facing API. Specify the workflows and the data that flow between your walls. This is tip number 3, look outward and beyond silos.
Thanks, Amber. That one's near and dear to me.
Yeah, me too. Now, this next tip has less to do with the researching and selecting the right system, but more to do with your overall project success. Many requests for proposals ask a very specific question. Estimate how much staff time will be required to implement and configure the proposed system. Now, this is a really good start, but it's very difficult for proposers to answer. Proposers don't know your staff. They don't know their skill sets, and they don't know their other obligations.
I agree. And I don't know how many meetings I've participated in where we churn and talk about all the implications of this really important question. But I wanted to share with you that we recently lost a project where the Environmental Health Department, I thought, showed a lot of pragmatism and wisdom on this point. Tacoma in Pierce County, Washington. They managed their project such that funding for the software and the implementation, that was budgeted. There was no problem there. The project was ready to kick off, right? Well, no, because where Pierce County saw a gap was in their own staffing. They actually went and sought grant money from the state's Foundational Public Health Program, but not to pay for the software, not to pay for the implementation, but to pay for an FTE that could be added to the department. And these new hires, there ended up being 2 at the end of the day, had the express responsibility of backfilling and supporting those who are key in configuring the new system. So in sum, when you budget and you plan for your next system, really try to accommodate a schedule and resources which will enable your staff to participate fully and to help quickly return to operations. Just a quick aside, I was at a very large health department just 2 weeks ago, and we were talking about their go live, and we were sitting around a table, and a couple of the program managers spoke up, and their contribution to the conversation was this: when we implemented our previous system, there were just 3 people in the room that set all the requirements. We didn't participate. And what they appreciated about this project was that all the different program areas had their chance to participate. It made all the difference for them. That is only possible, of course, if you've resourced appropriately. So to confirm this, we ask that you look to your budget and your project planning. Please verify that your staff who already have daily responsibilities are not double booked on your next project. This is tip number 4, budget for total project impact. I think it's time to rethink field inspection. So let me make a pitch. In my opinion, keeping a paper checklist mentality is incompatible with getting the most out of your field inspection software. I know that's how we were all trained, but let's rethink it. First, I will make the point, please give your inspectors the tools they need. To me, that means the right device, commercial wireless where it's available, and think about what is the right device for the type of inspection they do. By this, I mean, a pool inspection is perfectly suited for a smartphone. You may hire 100 interns or techs to come through and open up your pools at the beginning of the season. Cell phone is perfect for that. Take lots of pictures, you only mark violations, there's relatively little narrative and probably no printed report. There's nobody there to receive the report anyway. But a restaurant inspection, by contrast, might benefit by a laptop with a full keyboard and standard comments. So open your minds, check with your programs. There should be different devices allowed for different type of inspections. We're no longer at a place where one size has to fit all. Now, for another matter, I think it's time to start emphasizing photos more in order to minimize the requirement for long narrative. So in previous incarnations, you might have worried about the space that's required for a lot of pictures. That constraint is essentially gone in modern data systems. Take pictures. Include the pictures in the inspection report if you're willing to do so. Annotate them, mark them up. Remember that they have metadata about when they were taken and the location they were taken, so they are kind of self-documenting. Speech to text is another helpful option, as it helps inspectors, at least those who can work in quiet places, such maybe for the pool program, capture their narratives very quickly. And while we're rethinking field inspections, it's not just about the tools the inspectors need, but how the technology can help the inspectors get more coverage. So we've seen situations where you might have one inspector assigned to 1,000 facilities. That's a lot to cover in the course of the year. So data analytics, like those shown here on the right, should be used to help prioritize and manage and level those resources to get the most coverage you can get and focus on the critical inspections first.
I think that's amazing. We've seen city and counties doing all sorts of amazing things when they really have that real-time data at their fingertips. It really kind of surfaces like the problems and things maybe that they didn't even know was going on. One other thing that we have seen over the last couple of years with that data and also just, the rethinking of inspections is really getting creative with ways to really solve those volume increases and the staffing shortages. One example is virtual inspections for non-critical inspections or re-inspections. During the pandemic, health departments began conducting virtual restaurant inspections where a restaurant manager would walk inspectors through the facility while connected by video. And although they have their limitations, inspectors are able to observe things like an operator doing a temperature check for food or refrigeration or warming units. Also checks for sanitation concentrations and proper glove usage, or even like cleanliness of food contact services. They can see through the video of services. So while in-person inspections are best for some things, the time savings of virtual inspections through this pandemic have been realized. And some of the numbers show an inspector can perform 3 times more inspections virtually than they can in person. So agencies are really now reimagining how they can take advantage of these cost savings going forward.
And I know that's especially true, Amber, when you're in a rural area and the drive time from inspection to inspection is great. So this is tip number 5. We want to encourage you to rethink field inspections. And to confirm this in your own project, require that the proposed solution solve for iOS, those are Apple devices, Android, Windows, make the most out of every device, take advantage of its features.
Now, what is an aspirational project? It's something outside of the norm, something that boosts morale and gets the blood pumping. This might be pursuing voluntary program standards. It might be placarding, scoring, and grading. It might be achieving the Crumbine Award. It could mean having the flexibility in light of what might happen, like a pandemic or a natural disaster, or an unfunded mandate. It could mean proactively preparing for these situations. It might be a unique program which assures that underrepresented operators get what they need to be successful. In your requirements, ask yourself, what is that aspirational project? And what do I need to put that in my 3-year plan? To confirm this, flag, even if it's just for your internal documentation, which requirements support that aspirational project. This is tip number 6, plan for special aspirational projects.
Thanks, Amber. Federal stimulus dollars to your city, county, or district actually came in 2022. Now, you may not have gotten the memo, but they did. And the whole flow is going to repeat in 2023. The American Rescue Plan Act, or ARPA, made certain that every municipality and health district and lots of other entities were granted these stimulus funds. These funds have purposely vague spending guidelines. Congress wants the local to have the flexibility to do what they need for their own population. So let me start by assuring you that your environmental health data management project is directly eligible for ARPA funds. Now, we know from experience that not every health department has a line of sight to these funds. After all, the Treasury guidelines don't use the words environmental health or even software, but the guidelines do talk about protecting the public health. They do talk about replacing lost revenue, enabling underrepresented communities, and most importantly, preparedness for the next emergency. In 2020, that meant working from home, a digital front counter, flexibility to revise, rethink, and even change your plans. So even if you don't get that line of sight, there are other ways to think about this one tip. For example, when ARPA funds flow into your state, your county, or your district, keep in mind that that can free up budgets for other projects like ours. Also think about getting extra help in the office, just like the Tacoma example. That makes a project more viable and more attractive. In any case, one thing is true. If you're ready to make the project happen, we're not going to see funding opportunities like this again in our careers. We're just not. So let's not let this moment pass by. One last thing. Remember that your IT department just may need a clear signal of your project's urgency. So that could come from an end of life signal from your existing system. For example, Tyler asking digital health department customers to move off that platform. Or it could come from the underlying technology. Like think about when Microsoft retired Internet Explorer. That had a ripple effect. And if your existing system depends on Internet Explorer, it's not long for this world. So think or ask what your IT department needs from you in order to prioritize your project and make room for it on that list. This is tip number 7. Tap into these non-traditional once-in-a-lifetime funding opportunities. Now, to confirm this in your own project, we recommend you make and document an outreach to your budget officer or equivalent to validate what is available for your project, not just in software, not just in services, but ask about hardware, ask about additional staff persons, ask about other parts of your responsibilities that could be offloaded so this project can be undertaken. And I'm going to paste into the chat a link that is kind of cool. It's an ARPA spending tracker, and it tracks across the US all the cities and counties that were willing to describe their projects. And that should give you all inspiration for what types of projects are being funded. Surprise, it turns out we squeezed in one more tip, number 8. If your agency must use a RFP or request for proposal, then we understand you're entering into a regimented relationship where the communications are unfortunately kind of truncated. The rules can be very strict. I'm sure you all know. In this situation, please do yourself this favor as you consider the requirements. Be specific. Take the extra time to be explicit, especially where your requirements might be unique to your local jurisdiction. Interacting with third parties, vendors that aren't part of the project, such as your state health department, is one type of risk, and I have an example. So this is an actual requirement from an RFP. Okay, so it reads, integrate, this is a requirement, integrate with other applications such as county's time card system, California Environmental Reporting System SERS, Solid Waste Information System Digital Inspection Program, Swiss DIP, which sounds delicious, GeoTracker, and enable departments and platforms to connect to the system. Whew, that's a big chunk, right? But what they didn't describe is they didn't describe what technical methods will be used, what data will be exchanged, on what frequency. Is the interchange stable, or should we expect there to be twists and tweaks all the time? Why do I say this in this way? Because when the details are lacking, the proposer will assume the worst. They'll assume the worst sort of troublesome relationship with the time card system, for example, and that adds cost to the proposals you get back. So what can you do to assure that the vendor and that both parties are on board and the transactions are known? The frequency is reasonable. For example, two-way interfaces are more complex than one-way interfaces or exchanges. Real-time interfaces are more complex than daily or weekly updates. And the real red flag is undocumented requirements. You know, that when we get into the Q&A and the responses, well, just trust us. When we get into the contract or we get into the project, those details will be known to you. That's just very risky, and we encourage you to avoid that. So this is our bonus tip, tip number 8. Know when and where to be prescriptive. And to confirm this, this might be the toughest ask of all. You have to find somebody who would be technically able to implement what is being suggested. Ask that person or group to read the section and say whether they've been given enough information to estimate the work. If there's not enough information to really estimate the work, then there's not enough information to get a reliable proposal.
So here we are. Let's review, and then I think we'll have some time left over for some questions.
Sure.
Number 1, please don't try to recreate your old system. Require a solution that's going to work for you for 10 to 20 years. Number 2, in the same vein, shift resources from IT to the cloud and to the vendor to ensure that your system is always up to date. It also makes the technical support part easier on you as well. Number 3, insist that your next, more modern solution exchanges data, workflow, and tasks with other departments. You shouldn't have to log out and log in to multiple systems. Number 4, as leaders in your organization, it's important to the success of the project to budget for time spent away from day-to-day tasks. Have that time covered by other resources where possible. Number 5, field inspections. Take advantage of the wireless internet where it's available. Rely on photos and other features of the phone to make your job easier. Do not try to recreate the FDA checklist. Those templates were not designed with modern tech in mind. Number 6, look to your next horizon and just a little bit beyond that. In doing so, you'll have an easier time justifying the project and find that there's more enthusiasm for tackling that project when there's something really cool, something really aspirational on the other side. And number 7, do not let this once-in-a-lifetime moment pass you by. These funds exist. There are ways to get benefit, but you may have to be persistent. And finally, in our bonus section, don't leave the details for later. When the requirements are not familiar to your reader, take the time here, really provide the details. It's going to save lots of time and money and frustration.
Thank you, Amber. It's been an absolute pleasure collaborating with you on this. And I know for certain that we have some questions queued up. I think now might be a time for us to introduce Jill. Jill is our host today, and we've asked Jill to review the questions that have come in.
Great. Thank you so much, Daryl and Amber. That was incredibly insightful. So audience, just a reminder, if you have questions, please post them by clicking on the Q&A icon on your viewing screen. Try to avoid posting them in chat, as that takes a life of its own and it might be missed. We have received a number of questions. So let's start with this. Is there a place where all the requirements for a system have already been written?
Sure, I can take that one. Having a model RFP or a model set of requirements is a great place to start. There's nothing more intimidating than a blank page. I know that the National Environmental Health Association, NEHA, took on a project 3 or 4 years ago to collect well-written RFPs. You definitely could check with those folks. You could check with us. We have a model RFP to get you started, and it's all above board. You're not going to take it verbatim. You're going to read a requirement and decide whether it applies to you. And if it does, keep it. And if it doesn't, strike it or tune it to your requirements. So I think maybe that might have been our bonus tip, is not to ever start with a blank canvas, because that can be a lot of work.
Great point. We love the bonus tips. Okay, next question. What happens when we want to change something, like when fees change or we have a new law requirement?
So Daryl, I can take that one. So this is a great question. I'd assume it was table stakes, but for whatever system that you choose, you want to make sure that it is highly configurable. We know that things like checklists and standard comments and fees and reports are going to change. So definitely look for that highly configurable platform. And then as a part of your early training, as a part of the documentation, you should be able to understand how you can do some of those things on your own as well, like adding a custom field that you now need to collect, or change those checklist items or comments by yourself.
And I know this isn't strictly speaking an environmental health example, but Amber, I know you were very involved at the beginning of the pandemic, and you saw many examples where folks took their configuration and they took it to the next level. Do you have a couple examples?
Yeah, I mean, we saw a lot of our customers just getting things that maybe it was like not something that they did every single day. Maybe it's an application, maybe they got 7 to 10 of those applications a month. But they were able to quickly add them online so that they were available and they didn't have to have anybody come into the office during that time. And they were still able to continue those types of services. So those are some, we saw a lot of agencies do that.
All right, that's great. Okay, this is a good one. What if we don't have internet connectivity where we work? Our OSS program is mostly out in the country where there's no coverage or the coverage is spotty.
Yes, OSS is individual septic systems, where you're outside of city sewer. So what that question is really saying is that for that health department, their inspectors maybe do a lot of those types of services, and that's out in areas that is undeveloped. They're undeveloped and it's frankly not coverage. So we keep using the phrase table stakes. We feel like working offline for your field inspectors is table stakes. It's going to happen. You're going to be in the basement of a McDonald's, you're going to be in an industrial area, or you're going to be out in a new development and you're not going to have coverage. So even though I emphasize taking advantage of wireless connectivity where it's available, we recognize and we agree there should be a requirement for your inspectors to go offline. But we're thinking go offline more intermittently, like you check your phone, oh, I can't get my email yet, but you drive around the corner and all of a sudden your email clips in. That's the way we think about it. But we understand offline is a reality.
Great, thank you for that answer, Daryl. Next question, if I move to the cloud, what kind of insights are available to me?
So I can take that one. Again, a great question. First, at Excella, we're really putting a lot of our investment into the cloud. And so that's where you're really going to see a lot of the new features appear first. One of those new highly desirable features is the new dashboarding tool that we call Excella Insights. This comes with your subscription. Have you ever heard of Microsoft Power BI? I'm sure you have. Well, that is right in the browser, and our Excella Insights solution is built on that platform. So those dashboards or your Monday morning report can set the team's direction for the entire day or week, and it's available for you right there inside the software.
So Amber, about that, because you mentioned Power BI, if we already have Power BI gurus in our office, could they use that tool in the same way?
That's a great question. So we actually have built a much easier to use interface on top of Power BI within Excella Insights that really reflects the Excella data model. That basically means, these are the fields that you would use with environmental health reports and things like that. So you don't actually need to be a guru to create the Excella Insights dashboards. However, those skill sets are still really valuable because we also have an enhanced reporting database that allows you to connect your Power BI that you may already have and combine it with other data sets from other systems. So that's really the power in, the data analytics that we talked about, is when you can layer on multiple different data sets that's going to provide you the insights that you need to make those data-driven decisions.
All right. And just a reminder to everybody, we have a couple more minutes left. We're getting to the last question I see, but we have a few minutes. If you do have a burning question, please post it in the Q&A icon. Okay, this is the last question I see for now. We're having difficulty hiring resources to manage our on-prem EH solution. talk about the resources needed if someone transitions over to your Cloud solution.
All right. Well, that's multifaceted, right? So without more detail, I'm going to make some assumptions. So one assumption is that the person or persons are kind of in a help desk posture, maybe with a county IT department, and maybe they have responsibility across lots of apps that are supported by county IT, from your timesheet all the way through to payroll. And you're right, we are all struggling to retain those, really technical resources. And what makes that even, I think, more of a struggle is that the person that I just described has to have a lot of broad experience across a lot of applications and a lot of vendors. I think I would answer this person's question by saying, we actually would like to pop out of your IT department. We would like to emerge as more of a situation where you don't have to know what a database is or how it works. You don't necessarily have to know how to write a report. We will train you on the things that you do need to know about under Excel through its administrative interfaces. And hopefully that would be an attractive proposition for a new hire to be able to work on a brand new project on a very modern system that has a lot of capabilities and that puts them in a place where they really could be a hero. Do you have anything to add, Amber?
I think that is great. I think I'll just add one more thing that it's really important, and you kind of called this out a little earlier, is to have those internal cheerleaders. So even if the resources that you have today, that your business users, assigning them, basically that leadership role to really champion the new solution within your organization is going to make a huge difference. Especially pick people that they, your staff trusts, right? That they have a lot of respect for. And that is, I think, going to help that transition much easier.
That's a good point. I wish I'd thought of that. And calling back to that earlier reference I made, I'm thinking of the people who are around that table. Remember my example of how enthusiastic they were that they got a chance to play a role in the configuration of the new system. I'm thinking back around that table, and these were not all millennials. Right? Some of these were program managers who had been in the program for 10, 15, 20 years. They really knew what was what, but they came into the project with really a can-do attitude. That enthusiasm made its way throughout that room and on out into the organization. And I feel very confident that they'll have a successful and fun go live.
Great. And we had one more question come in. And I think we'll wrap it up after this question because we're just at time. Will there be an easier way than using Conwiz online to add and update program fees?
Oh, okay. Well, Conwiz refers to one particular legacy product called Envision Connect, short for Configuration Wizard. And it was developed with a certain mindset and philosophy in mind that frankly is not modern. It's not part of our go forward plan. You won't see anything like that. So the question, quite frankly, is how would one go and maybe add a custom field or add a new fee or change a value in a drop-down combo box? And Excella's web form has its own admin screens. So you just tap up in the right corner, you choose login as admin, and then right there, there's all those options. You don't have to move through it sequentially. Amber, you're really the expert, and I know your team's been doing a lot of work in this space too.
Yep, definitely.
All right, so that concludes our Q&A portion. So I'm going to turn it back over to you, Daryl and Amber, to take us out. And just a reminder to the audience, we did record today's webinar, and that will be shared out with you. And I will turn it over to you, Daryl, now. Thanks.
Thanks, Jill. So I want to thank you, Amber, and to our colleagues that are on the phone. You have with you now these experts, you have this expertise, you have these tips. This is really your opportunity to shine. Amber?
Yeah, and we're here to help too. So if you have any questions, please, reach out to us. And
We're
thanks for your
excited
time.
about your project. Thank you. Have a good day.